Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember, click here to check out our brand new app-based NCLEX product, loaded with the highest quality NCLEX style practice questions, and complete with detailed video rationales that break down the question for you. So finally master all those darn select all that apply questions. Plus, all our NCLEX memberships come included with our entire library of over 1,000 videos and study guides and cheat sheets. Come see why over 100,000 students have trusted their future to SimpleNursing.com. Click here to get started for free.
Next up, we have muscle relaxers. So Dandruline, Cyclobenzaprine, Cariprazole, and Baclofen. Now, all these drugs relax the muscles, but they do it in a different way, which we'll discuss in a moment. So the big three test tips is that all these drugs can cause sedation or drowsiness, which is to be expected and completely normal. So the key point is we do not stop taking these drugs if the client reports dizziness upon changing positions, which is to be expected. And we educate clients to have no alcohol, and we do not stop or abruptly stop this medication. Since alcohol with these drugs can cause a synergistic effect, basically worsening that sedation, and we never stop abruptly, which can cause a rebound effect. Now, the first muscle relaxer is Dandruline, given mainly for muscle spasticity, like spinal cord injuries, cerebral palsy, MS, and even stroke clients. Now, the mechanism of action is that it acts directly on the muscles to prevent the release of calcium, which in result reduces or weakens the force of contraction. So the memory trick we use is calcium contracts the muscles. So with less calcium, we get less contraction. Or you can think that calcium is hard like the bones. So less calcium, we get less hard muscles. Now the big side effect and the key points to write down is liver toxicity and sedation and drowsiness. So, for exams, don't get tricked. We report the liver toxicity like elevated liver labs and even jaundice, that yellow skin. And we do not give to liver-diseased clients like those in cirrhosis or even hepatitis. And lastly, there's no need to report sedation and drowsiness since these are normal side effects and to be expected. We just teach the patient to be safe here. So Kaplan says Dandruline is a muscle relaxant, and Hesse says Dandruline is contraindicated with MS and cirrhosis. The key word here is cirrhosis. Just think sclerosis. We have a scarred liver. Now, next up is the muscle relaxer Cyclobenzaprine and Cariprazole, given to reduce muscle spasticity or muscle spasms after surgeries on open fractures. Now, caution, don't let the NCLEX trick you with sound-alike drug names. Cyclobenzaprine is not cyclosporin. So, I call cyclosporin cyclosporin, which spares organs from rejection. And it's not cephalosporin, which is an antibiotic. So remember, cyclobenzaprine sounds kind of like clozapine, that psych drug for schizophrenia, which zaps immunity, leading to infections, so just think clozapine is not a zaprine. So the memory trick we use is cyclobenzaprine. Just think of cyclobaxaprine. Like a cyclo twister hit your back, and now you need a muscle relaxer. For cycloben, we give cyclobac. Now for the side effects. So a Hesse question says Cariprazole, huge risk for dependency, and drowsiness and sedation. Now, for the patient teaching, an ATI question came up that says taper off the medication and do not stop abruptly. And a Hesse question says Cariprazole, we avoid the beer. Well, that's disappointing. So no beer bongs, no beer pong, and definitely no beer goggles. Thank you so much for that tip, Hesse. Basically, we avoid all the alcohol for all the muscle relaxants. So, not just beer, but wine, liquor, you get the idea. Now, next up, we have Baclofen, given to treat muscle spasms in spinal cord injury, cerebral palsy, multiple sclerosis, And this drug actually decreases the flexor and extender spasticity. Now, the mechanism of action is it enhances GABA in the brain, kind of like how benzos do, which leads to more relaxation of spazzed out muscles, which is good. But the bad news here is it really relaxes the body, making everything low and slow. So the common side effect is constipation. So the GI system that's really low and slow. So we just teach increased fluid and fibers. And secondly, we get a low and slow blood pressure with orthostatic hypotension, basically dizziness upon standing. Now, this is to be expected and is not an adverse effect. So we teach slow position changes to prevent falls. Just think, when the BP is low, then we gotta go slow. So the key point here is dizziness upon changing positions is not a contraindication to giving this med. So we continue to give it. And we never abruptly stop any muscle relaxant. So the memory trick here is Baclofen. You gotta back off slowly, do not abruptly stop, and change positions slowly. Basically, get off your back in Baclofen very slowly. Now, the HESI had a question about this, stating that the side effects of Baclofen is orthostatic hypotension, dizziness, and nausea. And a potential deadly effect is rhabdomyolysis and multiple organ failure. Now, these two were only mentioned by the HESI, and we didn't see it mentioned by any other question bank. So keep that in mind.
Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.